Hi everyone, my name is Zuri Inzunza. I go by she, they pronouns, and I'm a fourth year global health major at UCSD. My thesis project is on addressing the low provider health literacy on LGBTQ health and its effects on trans and non-binary young adults care. Before I get into my thesis, I want to set the stage for my research project. When you go to a provider, there is an unspoken expectation that physicians know how to take care of you. While you may not feel comfortable in healthcare settings or going to the hospital or even trust your doctor, you would at least hope that they can provide treatment or preventative care. However, this does not reflect the lived experiences of trans and non-binary people. When it comes to these individuals, a study found that 24.31% of patients have had to educate their provider about trans people when they seek care. This alarming data drove me to research the barriers that trans and non-binary young adults face in the US healthcare system, and more importantly, how to find solutions. I noticed that many interventions on health literacy place the burden of knowledge on the patients. However, with this target demographic, the knowledge gap seems to be on the provider's behalf. As a gender queer young adult, I am aware of this gap through the poor experiences that myself and other gender nonconforming young adults experience when it comes to seeking health services. Using a non-systematic review, patient narratives, and applying the minority stress theory, I found that regardless of intention, whether it be willful ignorance and discriminatory practices, or a lack of trans and non-binary visibility and provider training, the impacts of low health literacy influence adherence, experiences, and future health-seeking behaviors. Social stigmas do in fact play a role in health literacy as it has tangible impacts ranging from social exclusion to structural violence. Factors such as provider attitudes about trans and non-binary communities, limited training, and heteronormative language and practice are some. Finally, accomplishing equitable care needs methodologies such as case-based or narrative approaches that are built on community input and provide an interactive learning experience for healthcare providers. Addressing this issue is essential because it brings awareness to the gap of knowledge and starts a conversation that practices and languages used in the healthcare system today don't have trans people in mind. When it comes to healthcare systems, if equity is not at the forefront, more needs to be done to make sure that that is the case. Thank you.